Catherine Maley, and I have the pleasure today to interview Dr. Paul Parker, a board-certified plastic surgeon and founder of the Parker Center for Plastic Surgery. So, Dr. Parker, what influenced you to get into plastic surgery to begin with?
What influenced me to be a plastic surgeon was the fact that a patient would come to me with a concern, and I'd listen carefully to their concern and could take them to the operating room, and within a few hours change not only how they look, but how they felt about themselves and that concern. So in a certain sense, immediate gratification using technical skill that I had acquired.
Mm-hmm. And by the way, how many surgeries have you performed?
By our best count, our guesstimate, we estimate maybe around 35,000 surgeries over the years.
That's fantastic. None of us patients want to be number 2. We want to be number 30,002. So, how do you identify the right candidate for surgery? Or is everybody a candidate for surgery?
Well, not everybody is. When patients come to see us for consultation, I'll listen carefully to their concerns, their what bothers them, their expectations, their motivations. After listening to them, I'll examine them to see if their anatomy is such that it justifies surgery. I'll then talk to them about treatment options, including surgical options. And again, circle back to the notion of can I give them what they want with a high level of consistency.
Gotcha. Just out of curiosity, who would you say no to? Like, why would you say no to somebody who wanted surgery?
Well, I think it depends. If the patient doesn't have the right motivation, if their expectations are inappropriate, if their anatomy is something that really can't be fixed to meet their expectations. So a variety of reasons like that. That it's really a matter of listening to the patient, examining the patient, talking to the patient, and get a feel, is there the right fit here whereby we can deliver what'll make you happy.
Gotcha. Okay, and then what advice would you give to patients to get the best result possible from their surgery?
Best result? Well, I think interview your surgeon carefully. Make sure there's a good fit on both ends, not only from the surgeon's standpoint, but from the patient as well. Make sure that the surgery is being performed in a safe environment, in an appropriate licensed facility by appropriate people, well-trained, well-experienced board-certified plastic surgeon, board-certified anesthesiologist, well-trained nurses, and a nurturing staff. We're fortunate in that we have a smart group of nurturing women who help hold our patients' hands before, during, and after the procedure, because the patient experience is critical to the patient's outcome and really enjoyment of the whole process.
Okay. By the way, I hear board certified, and then I hear like board trained, all these different words. What are we looking for when we're looking for an experienced, skilled plastic surgeon?
Yeah, it's a great question, and what I'm going to tell you almost sounds silly on its face, but I'll tell you anyway. And that is, it seems logical to me. If you're going to have plastic surgery, you want to have plastic surgery by a plastic surgeon who's certified by the American Board of Plastic Surgery. There are other groups out there that aren't necessarily recognized by the American Board of Medical Specialties, but a well-trained and experienced plastic surgeon certified by the American Board of Plastic Surgery is probably your safest bet.
Gotcha. Okay. And what makes your practice so special? Because it really is special.
Well, I think I'm fortunate in that I received very, very good training at NYU Medical Center years ago, have a lot of experience, as we've talked about, with 35,000 patients. But what is also very unique is the caring and considerate women that surround us in the practice, both up in the office area of the practice as well as in the operating room in our post-surgical recovery unit. These women are smart, they're well-trained, they're very caring, and they really make the patient experience something that's very memorable for our patients.
That's so true. And how do you balance work and life? Because I know you're a very busy surgeon.
Yeah. It's an important concept for all of us. And I guess as we get older, we realize how important it is. But I'm fortunate in that I have a wonderful wife who's my best friend, Together we have, we're remarried and we have 7 children and 8 grandchildren between us. So that keeps us busy, and we're able to balance things between working together and playing hard together and enjoying, what life has given us in terms of family, friends. I have to admit, being an avid golfer as well. So all those things together kind of keeps us busy but very happy.
Oh, that's terrific. And I did want to find out from you, because you have been around, where are you going? What does your future look like? And what does the future of plastic surgery look like?
Well, two-part question, I guess. Regarding plastic surgery, let me answer that first. I think the field will continue to evolve the way it has. There's been great interest in minimally invasive, non-invasive techniques. We're very excited about something in our office called Morpheus 8. It's a radiofrequency skin tightening. It's a totally non-surgical entity. We've had good experience with it over the past couple of years, tightening facial skin, and now we've just gotten Morpheus Body, which is effective in tightening parts of the body, all without surgery. And I think we'll see more and more of that in plastic surgery. So that's very exciting for us in the future. As far as me personally, I think as you listen to what I say and as I think about my life, I really enjoy what I do day to day. I'm very fortunate to work with this wonderful group of people, and it's very stimulating to me. So I envision continuing to work for quite a number of years now. My techniques have evolved over time. We're getting very good results and happy patients. I can't imagine what else I would want to do aside from time on weekends with family and golf and things like that. So I'd like to keep doing what I'm doing and evolving the way I have.
Nice. So the last question, what is your greatest joy in life?
My greatest joy in life. My greatest joy in life, I've been blessed with many things in life. Wonderful wife, wonderful family, wonderful practice and career. I suppose as you get older and you think about these things, we have 7 children between us, all of them wonderful. Many of them now have spouses, 8 grandchildren, and the fact that I've been able to play a significant role in their lives and making all these young people, helping make these young people the kind of people they are, I think is probably my greatest joy.
Thank you so much for your time, Dr. Parker. I really appreciate it.
My pleasure.